My name is Riley and I did sleep apnea. What is it? It is a sleeping disorder where breathing repeatedly stops and starts during sleep. There are 3 different types of sleep apnea: obstructive sleep apnea, central sleep apnea, and treatment emergent sleep apnea. Obstructive sleep apnea is the most common type of sleep apnea. It occurs when airflow is blocked from the muscles in the throat relaxing. Central sleep apnea is when the brain does not send the signals needed to the muscles that control the breathing. And treatment emergent is when somebody is diagnosed with obstructive sleep apnea and then it develops into central sleep apnea after receiving treatment. Some symptoms are loud snoring, episodes where you stop breathing during sleep, gasping for air during sleep, waking up with a dry mouth, morning headaches, difficulty staying asleep, which is also known as insomnia, excessive daytime sleepiness, known as hypersomnia, difficulty paying attention while awake, and extreme irritability. These are mainly caused by the lack of sleep, just being tired. Some risk factors include excess weight, neck circumference. People with thicker necks might have narrow airways. A narrowed airway can be inherited. Tonsils or adenoids also can enlarge and block the airway. This happens in children. Males are 2 to 3 times more likely to have sleep apnea than women are. Age, middle age to older adults are more at risk. And then, of course, family history. If you have a family history of sleep apnea, you are more likely to have it as well. Continued, there's also the use of alcohol, tranquilizers, smoking, nasal congestion, and medical conditions, congestive heart failure, high blood pressure, and type 2 diabetes. Here is a photo. Some potential complications: daytime fatigue, high blood pressure, heart problems, type 2 diabetes, metabolic syndrome, which is a disease that includes high blood pressure, abnormal cholesterol levels, high blood sugar, and increased waist circumference. This is linked to a higher risk of heart disease. Medications, it's a concern with medications in general anesthesia because people with sleep apnea are more likely to have complications after a minor surgery if they are prone to breathing problems. It's important that a doctor is notified if there is a history of sleep apnea before any major surgeries. Treatments include CPAP machines, BPAP, and APAP machines. A CPAP machine provides constant air pressure through your mouth or nose to keep your airways open. A BPAP machine is a lot like CPAP machine, but it delivers air with a different pressure, and that's based on whether you're inhaling or exhaling. An APAP machine actually adjusts the air pressure you receive during your sleep automatically. There's also different surgeries, hypoglossal nerve stimulation. This is where the nerves under your tongue are stimulated to keep your airways open. It includes a device that's implanted under the skin of your chest and connects to the nerve of your mouth. A tonsillectomy removes the tonsils. That creates a larger airway. Surgeries to remove tissue from the mouth and throat are also used to create that airway. Weight loss medications are now approved to be used for this as treatment as well. And then the mandibular repositioning mouthpieces. These are mouthpieces that cover the upper and lower teeth and hold the jaw in place. This prevents the jaw from sliding back when someone's laying down and blocking that airway. The tongue retaining device work works in a similar way, except it's the tongue that's held in place instead of the jaw. And once again, it's just to keep that from blocking that airway. All of these are great treatment options. The CPAP machine is probably the most common, and those are the least invasive options for sure. And then I did want to go back to this slide so you could see the person on the top. They sleep normally, and the person on the bottom cannot breathe properly from sleep apnea. And that is it. Thank you.